Thanks very much, Rob, and good morning, everybody. I'm happy to be here on behalf of Dr. Verna Yu, President and CEO of AHS, who sends her sincere apologies. As I mentioned to Rob last night, it is very unlike Verna not to live up to her commitments such as this. She actually quite enjoys speaking to audiences such as all of you and expressing her appreciation for everything that all of you do directly. But somehow when the Premier and the Minister call, she feels some sense of obligation. So I'm here in her stead and delighted to be here to welcome you to the 2020 Pain Society of Alberta Annual Conference. I'd particularly like to welcome patients and family members who are here with all of you today. Alberta healthcare system strives to be patient and family centered, and we can only achieve that goal when patients and families are involved in everything we do, including conferences like this one. Your participation and contributions to this work are critical for Alberta Health Services and our many partners to provide the very best fully integrated pain services to Albertans. I'd also like to thank the Society's leadership for organizing and hosting what is truly a monumental event. Over the next 3 days, you all will be hearing from speakers from across Alberta, Canada, and internationally. And I've been told that in total, there are more than 4,300 people registered for this conference. That's outstanding. And it speaks to the interest and the need for more conversation and sharing about pain and pain management. That's a staggering number, and it's also inspiring, as I said, because when passionate people come together with common interests to share their knowledge, their experiences, great ideas often emerge that advance the care of people living with and working in pain. We know people living in pain face a substantial physical, emotional, and financial burden. We also know that pain is the most common reason for people to seek healthcare services. And this in turn places significant demand on our health systems. Here in Alberta, every day, people seek help to deal with their pain, whether it's in our emergency departments, such as the patient I was asked when I was on call last evening, when I got a call from the South Health campus from a surgeon concerned about pain management for his patient. And also the home care nurse that called me in the wee hours about concerns about her patient or client receiving services at home. Our inpatients, our primary care offices, and specialist rehabilitation therapists, pharmacists, and alternative providers. With several national and provincial bodies paying very close attention to this need, AHS, our strategic clinical networks, and the Pain Society of Alberta agreed to collaborate on a provincial approach to managing pain, which led to the development of the Alberta Pain Strategy. This strategy was developed following consultations and input from more than 360 individuals from across the province, all with specific expertise and experiences to share. Chief among them were patients and family members, healthcare leaders, all of you who do research and deliver care to the people with pain, including but not limited to all types of and disciplines of physicians, nurses, nurse practitioners, occupational and physiotherapists, paramedics, pharmacists, and many, many more, which really reflect the multidimensional characteristics of pain and the need to approach them in a multidisciplinary fashion. You're going to hear more about the Alberta Pain Strategy later on in the conference. That strategy, as you will know, is now 1 year old, and Rob and Tracy Wazlik will be reporting about the progress a little bit later in the agenda for your conference. Even though the strategy is still relatively new, it's important to remember that Alberta has many established and effective pain programs throughout the province and the biggest chronic pain center in the country. So we're not starting from a blank slate, but building on the good work of many of you and many people who have been involved in the management of pain for some time. We know that we can improve the integration of services, we can build capacity within primary care and continue with other improvements to relieve pain for Albertans. And the Alberta Pain Strategy is going to serve as a guide as all of you do that work. I really like the holistic approach of the strategy. I'm pleased to see the Alberta Pain Strategy, like Alberta Health Services, patient and family-centered care strategy, focuses on the whole person and takes into account the person's biological, psychological, social, and spiritual needs. I'm so proud of the advancements in pain management that we've achieved here in Alberta by many of you here today, including those of you in our strategic clinical networks, the Pain Society, and the research community. We are in many ways a world leader in chronic pain management, thanks to all of you. And yet we know we can always do better. We've all experienced pain, and many people live with it. It is indeed a universal experience. So the discussions that you'll have throughout the conference and your ongoing efforts with the Alberta Pain Strategy are of utmost importance, because this work will ultimately make a positive difference in our own lives, as well as the lives of everyone we know. In closing, I'd like to thank the Pain Society of Alberta, our strategic clinical networks, 𝐒𝐔𝐁𝐄, and all of you who have helped in organizing this virtual event. I hope you all enjoy the presentations and discussions over the next 3 days. Rob, thanks very much and best wishes.
Thank you so much, Ted. Before you run away, you agreed to maybe hang out with us for a couple of seconds. It's an honor to have you here, not just because of your position with AHS, but because of what you do clinically. And I really wanted to ask a couple of questions just on your own experiences working in the world of pain. What was your experience like as the founding medical lead of the Calgary Pain Program?
Well, Rob, the first thing I have to say, I had great bosses, because 𝐒𝐔𝐁𝐄 was one of the people who recruited me into that position. It was a very exciting time. It was, to take you back, it was 2003, I believe. So some time ago. And what the former Calgary Health Region wanted to do at the time was try to take the many people that we had focusing on pain in our community and try to create a more population-based and integrated approach, because in many ways, the pain management you received really depended on which door you came to. If you happen to be referred to a psychologist, then you got a psychological approach. If you happen to be referred to an anesthesiologist, you got an anesthesia approach. And of course, nowadays we understand that really you may need one or more of those approaches, and the needs of your particular pain problem, will vary. Will dictate what kind of pain management you need. So bringing together all of those various people who were so proud to pain management around, and a common approach was the major challenge. Some of the people, Pam Barton, rehabilitation specialist, and well, obviously he's passed away now, and I see you have a memorial lecture in her honor. Paul Tanzer from psychology, Chris Spanswick and John Clark from anesthesiology, Neil Hagan, Vern Becker, who's on your program as well, from neurology. Tracy, of course, some other anesthesiologists, Martin Scanlon and David Ablett. So really bringing together these people who were so passionate and developing that integrated approach. And I'm proud to say we actually involve patients, not in the sophisticated ways we have now, but we did actually involve them in the work as well. So it was very exciting, and I think we, in many ways, got some things right.
Incredible. I think you just named half my mentors. So really quite amazing. And really to see how the pain program became the Calgary Pain Center, and now how we're trying to develop a provincial pain network. Amazing where all of this started at this kind of ground level, working to develop an initial pain program that really focused on patient outcomes. And as we heard, it's a passion of yours. To follow up on that, you've been, I don't want to be ageist here, but you've been around for a bit. I'm curious just how you've seen how we manage pain and how we approach pain, and maybe not just pain, but medicine as a whole, and how you've seen it change over the years in your own clinical practice.
Thanks, Rob. And I have been around for a few years.
Sorry.
No worries. So in no particular order, I think some really good things have happened. We've gone from and continue on this journey from a practitioner-based approach to a team-based approach to care, recognizing that most of our patients with complex problems need and deserve different disciplines. We've gone from, as I said, to sort of a single set of tools to different toolkits. I mean, for example, as a palliative care physician, back in the day, so to speak, I and my colleagues were often asked to see chronic pain patients in the hospital because we didn't have a chronic pain service. And, with all due respect to my colleagues and myself at the time, we had one set of tools, but as all of you would appreciate, not necessarily all of the tools necessary to meet the needs of chronic pain patients. I think bringing together addictions and chronic pain has been very important and very helpful for patients. I think we're still on a journey, but the influence of pharma, I think, has been significant in the past, and I think continuing to understand where pharma and other vendors can be helpful and supportive versus not influencing us inappropriately. And then the involvement of patients and families, obviously, in how we deliver services is really, really important. So I think those are some of the things that came to mind, Rob, as I reflected on your question.
Thank you so much, Ted, and we really do appreciate you joining us. And of course, when the Minister and Premier call, we can understand that Verna wasn't able to make it, but to have your expertise and your knowledge joining us today, it's a blessing in disguise in itself, and we do appreciate it very much. So again, thank you for joining us, and for everyone watching, it truly was an honor for us to have Dr. Ted Braun join us. Thank you, Ted.
My pleasure, Rob. Have a good morning.